ACT limit setting. This is the best way to set limits for your young child without enraging them, without making the tantrums worse. This is a method that can be used across the board, and it stands for A, acknowledge the feeling, C, communicate the limit, and T, target an alternative. And with this technique, we're going to remember to be a thermostat, not a thermometer. A thermostat regulates the temperature of a room. A thermometer matches the temperature of the room. For example, if your child is having a tantrum and they raise their voice, they raise their energy, they enrage on their face, right? We're going to be a thermostat and bring them back down. We're going to acknowledge their feelings. I see that you're very upset. We're going to communicate the limit. But people are not for hitting. And we're going to target an alternative. You may punch the pillow or you may punch the floor. Which do you choose? But we have a neutral face, a neutral tone, and we're bringing them down. We're de-escalating the situation. We engage before we enrage. Connect before you correct. Take a look at your child. Decide, why are they having this tantrum? Chase the why. Are they angry, which is usually a secondary emotion? Are they hungry, thirsty, tired, or could they be lonely? Is it possible to be lonely in a room full of people? Absolutely. Perhaps they're needing more one-on-one attention. Perhaps they're needing more strength, ability to make choices. They want to feel capable. If they feel weak or inferior, sometimes that manifests itself as anger. So we chase the why and we figure out, why is it that they are acting this way? Never ask a child, why are you doing this? Because they don't know. Why is an abstract concept for a child to figure out. It is your job as the adult to figure out why. You need to be chasing the why. Once you chase the why, then the learning can take place. But first we have to set the limit by acknowledging the feeling, communicate the limit, target an alternative. Once we've gotten the child calm by de-escalating the situation, engaging with them, then they are no longer in their downstairs brain, the primitive brain, responsible for fight, flight, freeze, their automatic responses. In order to get them up into their upstairs brain where the higher level thinking takes place, we have to connect with them and let them know, I am not a threat. I am here to help you and love you. I hear you, I see you, I understand, and I care. We modeled for them calm. I'm humbling myself enough to move down a level, maybe eye to eye with you. I'm lowering my voice. I am modeling patience, empathy, acceptance. I'm letting you know that I acknowledge your feeling, but your behavior was not okay, and I'm giving you options where that behavior is okay. I have not dismissed you. I did not raise my voice. I was fully loving and accepting as you explore behavior, choices, and consequences. This does not mean that you let a child get away with something. It just means that we're going to find out, why did you behave this way? What can I do as the adult to help you find a better way to channel or express those feelings? Children don't do things out of malice, out of meanness. In fact, all around the world, they don't refer to the toddler ages as terrible twos, treacherous threes, or frantic fours. They usually refer to this age group as the boundary pushers, which is a much more positive way to refer to this age group, recognizing that it is their job to push the boundaries, to try to explore cause and effect, cause and effect, cause and effect. What would happen if I do this? And also expecting a child to behave perfectly all the time or behave good is unrealistic. They don't know what good is. Now, when they do, when you know they know better, then you want to find out, why did they do that? What reaction were they trying to get from me or from someone else? What's happening in their little world that they are trying to get a certain response? Again, hungry, thirsty, angry, or lonely? Are they feeling weak? Then we regulate the temperature by neutral face, soft tone. I will listen to your words when your voice sounds like mine. And we model for them, I hear you, I see you, I understand, I care. We related to them with empathy by acknowledging the feeling. We communicated a limit, letting them know I'm not a pushover. We targeted alternatives. Not always does this work the very first time. And I tell people, I tell parents especially, this not working the first time doesn't necessarily mean that the child has to respond the way that you needed them to. For example, they might hit the floor. The tantrum might continue. But the beauty of a parenting technique like this, the beauty is that not only are you becoming stronger as a person because you've modeled patience and acceptance, and you've taken some time to chase the why behind a behavior, but you're also maintaining a positive parent-child relationship, and that is the most important. That's when a parenting technique works. Your child might probably be upset. The tantrum might continue. They might be so angry at you that they stomp away. But you maintained a positive parent-child relationship. You set limits, you set boundaries, and you modeled humility, patience, empathy, and love. And for that, the ACT limit setting method worked. You can follow me on Join Whole Heart on Instagram or on my website, wholeheartcrunchyparenting.com, or subscribe to my podcast on Apple Podcast, Whole Heart Crunchy Parenting. Be well.